Hello, welcome to iTutor Becoming a Medical Doctor video. My name is Nduvho and I'm a 6th-year medical student studying at the University of Cape Town. I'll be taking you through the journey of becoming a medical doctor in South Africa. We've all seen a doctor somewhere. We know of someone in our community who is a doctor. We've been to the doctor ourselves. So, what does a doctor do? A doctor is someone who provides overall clinical care to a patient. A doctor takes history, examines, does investigations, and provides overall management while taking into account physical, social, and emotional factors that affect the patient's health. It is often said that the good physician treats the disease. The great physician treats the patient with the disease. There are many reasons people decide to do medicine. Some say it is a calling, some are in it for the money, and for some it is to make a difference in society. Choosing medicine is a personal thing. Everyone has their own motive for doing it. I've spoken to some of my colleagues to give us their reasons for choosing medicine, which you can read through. The generic reason was to make a difference in society and also for job security. Something that totally screams, do not proceed and do medicine is if you know that you're scared of the sight of blood, because that's what you're going to be seeing for most of your life. There are really amazing things about being a doctor and not so great things about being a doctor. First off, I'll start off on the negative side of things. The fees are quite high compared to other degrees. One has to be willing to make sacrifices. You're also responsible for people's lives. This comes with high levels of stress. And of course, you work really long hours. You can work for more than 24 hours when you're on call. But then again, there are really amazing things about being a doctor. You get really immense satisfaction in knowing you contribute positively to a person's life. Interactions with the patients are also just really priceless. There is job security, which we've spoken about before, and there are also many specializations that you can get to choose from. You can decide to be a cardiologist, an anesthesiologist, a dermatologist, a radiologist, or any other specialty that you're interested in. And of course, you're well respected in society because you're deemed as the Superman, the Spider-Man, the Batman of society at times. So, the career hierarchy of medicine starts off as you start off as a medical student, which you do for 6 years. You then go on to become an intern, and you do that for 2 years. After internship, you become a community service doctor, which you do for 1 year. After being a ComServe doctor, you become what we call a medical officer. This is the general practitioner of the public sector. And then after being a medical officer, while you are a medical officer, you can decide to go on and specialize. So you have to become what we call a registrar. So depending on the specialty that you choose, you can do about 4 years of specialization. So after you've passed your exams, you become a specialist or consultant. So of course this doesn't end here. If you really want to go further with your studies, you can then become a subspecialist, also known as a super specialist. There are currently 10 universities in South Africa that offer medicine, with Nelson Mandela being the newest of the lot. The table on here shows you the minimum requirements for doing medicine in the country. Please note that it is quite a competitive field, and if you like to guarantee admission into the program, do above the requirements that are listed on here. Try and get distinctions if you can, and please apply to as many universities as you possibly can. Do not only stick to 2 universities. Try and apply to at least 5 universities because you do not know which ones will choose you. I've put up a table on the slide to give you an idea of the average tuition fees in each university per year so that you can make an informed decision on where to study. Unfortunately, the fees are quite high, with UCT being the most expensive in the country at the moment. The good thing though is that there are some organizations that do offer medicine bursaries. This is information that I did not have when I was still in high school. I was naive in thinking that if I worked hard enough in high school and also passed with flying colors, I'll be able to find funding without applying. Please note that this is all a myth and it does not hold true if you do not apply. I've listed the bursaries that do cover the medicine tuition. Please look this up. Please look this up if you're interested. Call and find out when applications for each one will open. So we've reached the end of the slides. I hope the information was helpful. The advice I can give you is that for you to choose medicine because you really love it, not because of material reasons or to please family members. I say this because there'll be a lot of tough times, and it helps going through them knowing you're doing something that you love. And if you do decide to go ahead and study medicine, see you on the flip side. It is a rewarding field if you choose it for the right reasons. Thank you so much for tuning in. That's it from me. Bye.